Hey, Dr. Ford, it's good to see you again.
Hello, good to see you. How are you doing?
Good, doing
Good.
doing well, doing well. Today I thought we could catch up and talk about how providers can make changes and help their patients feel more comfortable. I know in our last session we spoke about some of the changes that are happening in telehealth, but let's look at how providers can help patients feel more comfortable, maybe during a telehealth session or just during this time of change that we're all up against. What are some of the suggestions that you would have for a provider, maybe that's just starting out on telehealth to help their patient feel more comfortable?
I'm obviously going into it with an open mind and just finding out a little bit more information, maybe that, or a little more information that you hadn't asked in the past, or maybe that wasn't a concern in the past, but just finding out more about your patient and what's going on, what's their day-to-day involvement, how are they interacting, do they have people to interact with, are they been in the home alone, are there other people in the home, who have you had interaction with, just finding out more as much as you can about your patient and how they're making it or not making it during these times.
So is it kind of a checking in to see mentally how they're doing?
Yes, definitely. Yes, definitely, because this is a very trying time. You look at a patient who has a history of depression or a patient who has a history of anxiety and going through these times. Now it's a very trying time for them. Anxiety may be increasing when it's time for them to go to the store or go out, or even something as simple as check the mail or pick a package up from the door. You look at somebody who's been battling depression for a while and not able to have their support system around them, or not able to keep up with their action plan, or not able to have that engagement, which is a lot of times energy for them, that social energy, and with the interaction, not being able to do that can be very trying and very different for them. So now's the time for us as providers to just, step up to the plate,
Mm-hmm.
and see what we can do outside of the box to help even more, even if we don't know what the plate looks like.
Right, right. And I think you're bringing up great points because people are anxious, and when we are dealing with anxiety levels, if they're already heightened and then you have this on top of it, it can lead to several avenues of your patient trying to reach out to you, maybe more than on a regular basis. One thing I'm thinking about is referrals.
Yes,
So should providers have a set of referrals ready to go for these
yes,
patients?
that would definitely help. Referrals and then resources throughout the community. Here in Oklahoma City, there's a ton of resources and people stepping up to help out in any and every way. And just for providers, knowing who those people who are stepping up in the community to give our communities better access, and more importantly, being able to help them get through this very challenging time that they face, or that we all face each and every day.
Right, and it is challenging. And I think having a list of resources and referrals is probably a great idea for providers right now. Because, like I said, having patients that are already anxious, they may be reaching out several times a day to the provider because they don't know where else to turn. So, giving them those resources could also help the provider kind of um, put the patient at ease and give them alternatives to just reaching out to that same provider. So what about if you have a patient, you have your telehealth set up, and that patient is worried that they're not going to be able to have their testing coming up, their routine testing, or that they're not going to have a family member able to come with them if you do have a face-to-face appointment? How can a provider help that patient to feel more comfortable and at ease during this time?
And first, that goes back to the patient provider relationship, and the providers knowing the history and the makeup of the patient that's presented for them. One of the things you said, if a patient is normally has a family member or somebody with them during their appointment, and now it's on telehealth and nobody's there, how can we still, as a provider, meet that patient's needs? I think it's very important for us to have that relationship with the patient and know our patient, to know how we, even in these trying times, what we can do as providers to still meet their needs, whatever their needs is. And those needs are going to look very different depending on the patient that presents to us.
Right. Okay, so is there anything else, I guess, that you can give to providers during this time to help the patients feel more at ease? We've talked about resources and referrals and being able to maybe have a family member present during a telehealth appointment. Is there anything else that you can think of that could really help a provider in this time? And I mean, something else that maybe we should think about too is that providers probably have a higher level of anxiety than they normally would. I mean, they're having to learn telehealth. This is probably new for some providers, but they're also, you know, on the front lines of what's going on. So is there anything else that we can give them to help them through this time?
Just, I think the main thing is staying innovative, staying creative during these times for the providers, and not being too overwhelmed or stressed with work on themselves, and just keeping some type of action plan or daily routines that you were doing or already doing, as well as the patient, you know, letting the patients know that first, this is going to be okay. We'll get through this and we'll be here to help, but keeping them on a routine and keeping them on some type of schedule to get them through these very challenging days that lie ahead of us, I think is important.
I agree. And I think that some level of transparency might not be a bad idea, because we're learning this together. And I think that patients will be understanding of that. I don't think that compromises the quality of care. I just think it's, you know, maybe I don't know how to use Zoom, or, you know, just give me a minute and let me figure this out. I think being transparent with patients is also a good idea, and giving yourself a lot of grace during this time, because we're in it together. And I have found that many patients, they are patient with you, and they're accepting, and they're willing to hear if you're transparent with them. I think that they are.
Yeah, I agree. And that was a very good point. You know, just letting them know that, hey, if this is new, if you're a provider and this is new for you too, just being up and upfront with the patient, saying, hey, we'll get through this together. This is new for me also, but hey, guess what? We'll figure it out and we'll get through it together.
Absolutely. Another key I think that you brought up is making that relationship with your patient. And this might be that perfect time to develop that relationship with the patient that you didn't have before, because now you're starting to ask questions that you may never have asked in a face-to-face appointment. And something that I know that you're very, very well known for is, you know, that mind-body connection.
Yes.
So, you know, it might be interesting to discover if your patient is having anxieties that you didn't know about previously, how that might be connected to whatever they're coming in to see you for.
Yeah, good point. Very good point. And now with some of the calls that we've received in our office, and even with patients that I've worked with, you know, some of the you know, having a history of anxiety, but just how the anxiety is exacerbating and manifesting into other areas. For instance, checking the mailbox, or, you know, like I said earlier, picking a package up, or having to go to the grocery store, or just, you know, the mass of thoughts that they're having and being overwhelmed. And it's just, you know, terrifying for them. It can be terrifying for them at times.
I think these are great points that we're bringing up here. And I hope that many of these points will help the providers. And something else for providers is, if you have, I mean, any issues where you're dealing with anxiety or depression at this time, there are resources for you as well. There are many free resources right now for frontline workers. So we highly encourage you to reach out and, you know, you tap into the resources that you're giving to patients as well.
Exactly. And this is a good time for us, not only as providers, but the patients also, to, you know, for us, is a lot of talk about telehealth and maximizing telehealth and utilizing telehealth. And that's a platform that's based from technology. But what can not just the patients, but the community, the states and cities do with all the technology that we have? And in this interview, we're talking about anxiety, but there are many, many different apps. Calm is an app. Mindfulness is an app. Utilizing these maps, these apps on our phones, on our smartphones, to stay calm and stay mindful during these trying times. We are what we practice every day, unfortunately, but this is a good time with the extra time that we all have to, start some new practicing skills, start practicing new things that's going to help us and propel us times through these moments and for these times. Calm is a very good app, and some of the other technology apps that they have available, begin to use some of those.
Absolutely. There's one that I use every day, and it's called 3 Good Things.
Okay.
Extremely simple app, extremely simple. It's not full of any kind of bells and whistles. It's just every day, 3 things that I'm thankful for in my day. And sometimes that might be, I had a shower today. I had a shower. I had 5 minutes to myself in that shower, and that was great. And that might be the highlight to my day because it's busy. It's busy. So, providers, please tap into these things. There are resources, there are apps, there are people that you can talk to. If you're becoming overwhelmed at any time, or anxiety is stepping in, or, just telehealth in and of itself is too much, please reach out. There are people that you can contact. Look into HR department. There might be someone in HR. There might be colleagues that you have that are going through the same thing. Yes. Always take that chance to step out. It's definitely worth it. There's help there.
Yeah, you're never alone.
Absolutely not. Absolutely not. So thank you, Dr. Ford. I appreciate all this wonderful insight.
Well, thank you very much.
I'm looking forward to our next one.
All right. Well, have a good day and enjoy.
All right. Talk to you soon.
All right. Thank you. Bye.